so I have my towel to put under the patient's arm, the IV catheter with needle, 20 gauge, the extension set, a saline flush, an IV start kit, and a tourniquet. And before I go in, I'm going to check the infection control guidelines and make sure I'm going by the standard precautions, and I'm going to perform hand hygiene.
Come in.
Hi, Miss Lewis. I'm Jalen. I'm your nurse. Your doctor has ordered for me to put in an IV. Is that okay?
Yes.
It's only going to take me about 15 minutes.
Okay.
Is it okay if I touch you?
Sure.
Can you tell me your name and date of birth?
Emily Lewis, 7/25/97.
All right. And do you have any allergies, like to the latex or tape, any medications?
No.
No. All right. And which arm do you write with?
My left.
All right. So I'm going to get you to put your right arm out on the towel, just in a dependent position. And I'm going to go ahead and look for any veins that might pop out. And I see a couple. And before I get started, I'm going to go ahead and raise the bed to a comfortable position for her and for me, and check the protocols if she had excess hair, if I needed to shave or anything. So I'm going to put the tourniquet on. I'm going to go ahead and just put it over her sleeve, just to protect the skin integrity, and especially for older people, I would do this, and it's going to be kind of tight.
Okay.
All right, so I'm going to go ahead and palpate. All right, I feel one. And if I couldn't feel one, I would just get her to clench her fist in and out, or I would just keep tapping and then one would come, or I could also take the tourniquet off and put a hot compress on there to make the vein dilate. All right, so now I found my vein. I'm gonna go ahead and get my supplies ready. So I'm gonna go ahead and open up my extension set. Okay, I'm gonna wash my hands and put gloves on. Take this off. Okay. And I'm gonna go ahead and flush the extension tubing. That way there's no air going into the patient. There we go. Perfect. Okay. Now I'm gonna go ahead and put the tourniquet back on the patient to get that vein dilated. And I'm going to open the antiseptic and go ahead and clean where I want to insert the IV in a circular motion. Okay, and I'm going to let that dry. And for this vein, I'm going to use a 20 gauge because it's not too small of a vein or too big of a vein. I think it's perfect size. All right, take the cap off and feel. All right, I'm going to pull the skin taut with my non-dominant hand. I'm going to insert the needle 15 to 30 degrees with the bevel up. All right, and I see flashback, so I'm going to go about a half a centimeter to a centimeter more, and then I'm going to push the catheter more all the way in, holding the vein and popping the needle back in, dispose of this in the sharps, and put the extension tubing on. Okay, now I'm going to pull back, make sure I'm still in the vein, remove the tourniquet. All right, now I'm going to flush it. Miss Lewis, do you feel any burning or anything?
No, ma'am.
All right, and it's coming out, so you can see that I am in the vein. Okay. So now I'm going to put the Tegaderm on. Like so. And go ahead and take this off. And I'm going to go ahead and write my initials, date, and the size of the gauge and put this on there in case somebody needs to know who did this. I did it. And I'm going to take my tape and tape this to the patient. That way this doesn't get pulled or yanked when they're moving. All right, so I'm going to discard of all my supplies in the appropriate containers. So the needle is gonna go in the sharps container and everything in the trash. Miss Lewis, do you need anything?
No, I'm okay, thank you.
All right, I'm gonna take off my gloves, make sure everything is clean, and you have your call light, and your bed is low and locked, and just call me if you need anything, okay?
Okay, thank you.
You're welcome. All right, so I'm gonna wash my hands, and then I'm gonna go back and take off the, take out the IV.
Come in.
Hi, Miss Lewis. I've checked the physician's orders, and he said I need to take your IV out. Is that okay?
Sure.
All right, so I'm going to, if there was any infusions, running fluids, medications, I would go ahead and stop those. And I'm gonna wash my hands, and I'm just gonna go ahead and put on gloves. And I'm gonna go ahead and pull the skin taut and take the tape off. All right. All right, so I've got my gauze and my tape. I'm gonna go ahead and take a piece off. All right. And while I'm doing this, I'm checking the skin just to make sure there's still no irritation. Miss Lewis, are you okay?
Yes,
Do you have any
ma'am.
burning?
No, ma'am.
And I'm going to check the catheter, make sure it all came out, it didn't break off. And I'm going to dispose of this in the sharps. I'm gonna hold pressure, still making sure no irritation or redness, and just go ahead and tape this down. Obviously with better tape. Okay. Everything looks good. Miss Lewis, are you okay?
Yes, ma'am.
All right, so you have your call light and your bed's low and locked. There's nothing in the floor anybody could trip over. I'm gonna wash my hand, remove my gloves, wash my hands, and I'm gonna go back to the nurse's station, document date and time, my name that I inserted and discontinued the IV, how the patient tolerated it, the number of attempts it took me to get it, which was 1, which is great, and the type and size catheter, so 20 gauge needle, and I would document any teaching that I did with the patient. Thanks.